So do I continue health insurance? What do I do? You look at health insurance now, and you look at everything around. Health insurance is not just what's on your bottom line. You compare the cost of health insurance without. So you run a census, you run estimates, because it's okay to be a little off, and you'd say good or bad decision, and I'll tell you what it's even worth talking about. Or if you, in my example, do you even want to bring this up to owner or CFO, or if they're just ignorant, good for them. If it's small business employees, you may get a tax credit, so it may even be a better deal for you to keep health insurance, and that's what the government wants. They want the really small employers to get better coverage and buy through the exchange, because it's a non-issue largely. It's the greater self-funded plans that they're really after. If 25 to 50, you have no penalties. Consider the qualitative cost. Consider that if you drop health insurance, you are immediately giving everybody at least a 10% pay cut in your company. They don't understand that because they're not on COBRA, but as soon as you drop it, they'll get it, just like a COBRA bill. And you and your employees will have access to insurance benefits through exchange. That means it's a way for it to let everybody buy health insurance and probably at better coverage than you get on their own. So you don't have health care coverage now because your employees don't fall off trees. You don't have health care coverage now probably because you really think employees get back to work faster. It's probably become an entitlement in most of your companies. It's become a way of life. And this is really the opportunity to look at that and say, if we provide it, why do we provide it? And is it helping retention? Is it helping people get back to work? Is it a profit issue? Because no longer if you drop it, will somebody not be able to get health insurance. Everybody by 2014 will be able to buy it. So it's not this moral compass anymore. It's not a moral imperative. You will look everybody in the eye and say, if you like your doctor, you can still get it. It's just, we're not in the business. Or you say to yourself, we are an employer and we believe it's best practice to do it. We care about our employees. And we're going to do it, and you trumpet it, and you say it to as many people who will listen. And for the first time in most of our adult lives, which again for Ben is like 2 years, we'll be able to say our employees understand the value of insurance. He's filming this, and he wanted to film it, so. Tax planning will make financial sense for most under 25 employees to be an LLC or corporation. Why? Because of the tax credits. So if you're an individual and you have a sole proprietorship, I think you're going to be better off as an entity if this was the sole reason you did it. You cannot use different entities. I get the control group question a lot, especially from small restaurants or franchises. What if I put everybody in a different LLC? No, they're all combined. But the control group may work for other tax planning reasons, so it's not to say you shouldn't think through different entities. Wellness programs, I addressed this briefly. 2014, you get to provide an extra amount of 30% of premium benefit. This is mostly smoking cessation. Sometimes it's obesity planning, but that's really uncomfortable for a lot of employers, so it's usually smoking. How do we pay for healthcare reform? This won't affect a lot of people in this audience, so I'll go quickly through it. We have a new Medicare tax of 1.45%. So now it's up to 0.09. Sorry, it's now 1.45. It's going to be increased by 0.9%. Why not one to make it easy? I don't know. It's going to be 2.35% of wages, in excess of 250 married and 125 single. So this is basically the federal government's version of 66, 67 in Oregon. Because if you can afford it, you might as well pay for it. Sorry, that's my politics too, excuse me. Medicare tax on investment income. We're trying to get at private equity funds and passive income here. But there's now a Medicare tax of 3.8% on investment income. And you're going to see capital gains rise, so we're going to have a different world. And now higher 1040, if you filled out your April 15th return, you did Schedule A, at the bottom of the form you saw medical expenses unreimbursed above 7.5%. That line will now say 10%. So this is how we pay for healthcare reform. Whether you hear the rhetoric of Cadillac taxes, and I say this a lot, I don't even know what Cadillac is. I know I'm not as young as Brandon, but I don't even know if I've seen a Cadillac. It must be something nice because we call things Cadillac. And so that's really not how we're paying for it. It's this. The small business tax credit, which is the other reason you probably care. And this is also very simple. Tax credit for qualified small businesses. You make at least 50% of your premium contributions. 35% tax credits available. Now, it's a very complicated algebraic equation how you get there. But no, 25 or less employees, or fewer probably more correct English, and you make 50% premium contributions. If you don't do one of those two things, I don't care, you don't get it. Qualified small business has no more than 25 employees and average wages of no more than 50. And throw out ownership wages out of that. So now, if you have 25 employees, you pay at least 50%, are your average wages 50 grand or less? 100% of the credits available to an employer with 10 or fewer employees, with average wages less than 25. It phases down all the way up to 25 employees and 50 grand of average wages. and it is an extremely complex, it's almost calculus, how to get there. So, right now, take away from this, 25, average wage is 50 or less, do I contribute 50%? And if you don't do one of those things, but you meet one of them, you may want to look at how to get there, if that makes sense. So do you have 20, I want to be very clear on these points, because I get this question a lot. 25 or fewer FTEs, average annual wages, 50% of cost, then you can have a tax credit. So the example, 25 employees, 21 full-time, 4 part-time, average wage is 50. I'm making 50% contribution to health insurance. I do get a tax credit. Everybody with me on that? Anybody not with me on that?
Did you say something about it doesn't include you under?
Yeah.
The 50?
Right. The average wage, yes. Yes?
What happens if you have under 25 now, but sometimes you go above the,
You stop getting the tax credit.
but you get the tax credit now?
You get the tax credit for what you paid during that period of time.
Okay.
At least in the first year. Probably in the next year if you were 25 and started, unless you went back down. You wouldn't get it. So why healthcare reform might help you margins? I get this a lot from businesses. You're not required to buy health insurance. The small business tax credit may help you, and the exchanges are probably going to reduce your cost. And if you pay for it on your own, or you pay through it for your business, you're paying for it one way or the other. So you're likely to do better at buying it through a small business. So I think small businesses will stay with health insurance. I think they're going to buy them through exchanges, and I think they're going to be happy they did. So provisions you might know as we wind this up. You now have to file 1099. This is to illustrate there's lots of things in it there that you don't always know exist. Must file 1099 to all persons receiving $600. You used to go to corporations, various entities. If you do payroll for your organization, you now are going to have to start processing 1099s that you didn't used to have to do. And they probably don't know why they'll receive them, so they'll call you and say, why did you send this to me? There's a required break time for nursing, which is always true in Oregon, another part of Oregon in this bill, again, the Jeff Merkley. Form W-2 in 2011 will start to include medical premiums paid on behalf of an employee. So they still won't care and they still won't look at it. All those little fancy boxes at the bottom of the W-2. But they'll at least be seeing it. There's a statutory definition of economic substance. Does anybody know what that means? Good. State requirement for smoking cessation to expectant mothers. And this is shocking to me, but we need to obviously put that in. So now we're going to offer smoking cessation to mothers not smoke or expectant mothers. Apparently if you have kids, it's okay. 2.3 sales tax on medical device sales. So if you sell medical devices out there, you're going to owe 2.3. And what I think is really the most enjoyable provision is, and what I think is a blow to the Jersey Shore, as I often say, 10% excise tax on indoor tanning. So if you're going to join the Jersey Shore cast next year, you're going to have to pay a little more to be as tan as they are. And I've actually never seen that show. People talk about it all the time. So employer health insurance, understand what you care, analyze census, analyze your cost, understand the qualitative benefits, which one I always talk about here is I have my own doctor and I like them. That's a very scary situation for most employees. Access programs versus insurance, use of cafeteria plans. I think a lot of you are likely to say, I don't really care what you spend the money on. Here's $400 grand, or $400 a month, $400 a year, whatever. Buy whatever you want. Long-time care, disability insurance, medical, dental, buy-up plans. You know, I'm not in the business anymore of choosing what your benefits are. You choose. And understand compensation impact of terminating the 10% pay cut. So what did we talk about taking away today? And I hope you at least got one of these maybe. Understand healthcare reform process. Did you understand how a bill becomes a law? I spent a lot of time on it because it's how you answer the rest of the questions. If you understand why we're here, you understand access, you understand we care about affordability a little bit, and you understand we're going to tax the really rich to pay for it, then you understand how health insurance will go. What does it work to you? I really want you to take away from this understanding, why do I have health insurance? And if I'm important, why do I offer it? And do I even know? If I walked in this presentation today and we had a Q&A, and I asked each of you, why do you have health insurance? Could you have articulated? I hope you can articulate it a little better today. Can you increase profits by health insurance planning? I want you to understand, if you're a business owner or if your business owners ask you, why did you go to this presentation? You saw this guy wearing kind of a bad suit, and I apologize, I got dog hair all over. I can't stop my dog from shitting. I do not know how to do it. He talked about profits. Can I make more money? I think you can. And if possible, I want you to take advantage of small credit because it's now. And if any of you have 25 or less employees, you received a postcard about 2 weeks ago from the IRS saying, guess what? We've got a tax credit. And you probably said that's a lot of fancy words. I don't know what it means, but it sounds good. So key points, under 25 employees, $50,000 a year for tax credit. Penalties don't apply to most small businesses, and if you wasted an hour of your time to learn that, I still think it was beneficial because you got to see me. Plan updates, lifetime limits, coverage of young adults, 60 days notice, tax on HSA distributions, and under 27 is not imputed anymore. I want you to understand that multiple bills make for confusion. I hope you understand this is a very, very complex process. And I hope you found this hour to be somewhat beneficial to understand it a little bit. Question, comments, that's my name, that's my phone number, that's my email. I'll probably ignore it unless you tell me I went to your presentation, because I get a whole lot of emails from people wanting me to help them about stuff, and it creates a loyal relationship, and it's really complicated. So say, I attended your seminar, I thought you were great. I have a question, would like you to answer, happy to do it.